3.5 million dead, 170 million infected, millions of jobs lost, trillions in losses to the global economy, years of progress on global poverty rolled back. These are just some of the consequences of the COVID pandemic. We still don't know the full impact. What we do know is that this pandemic happened in part because of our broken relationship with nature. It was not a fluke. New diseases are emerging faster and faster. Infectious diseases, like COVID-19, will appear again, and sooner rather than later, unless we get to the root of the problem and prevent pandemics at their source, at the point of spillover. Zoonotic spillover is the term used to describe what happens when viruses jump from animals to people. Just like Ebola, HIV, and now COVID, most new infectious diseases come from animals, and the majority come from wildlife. Unfortunately, spillover events have been on the rise for the past 50 years. Once a new virus is in humans, containing its spread in our interconnected world can be extraordinarily challenging, especially if it is highly transmissible, mutates quickly, or hides within people for long periods of time. Most governments remain focused on improving the ability of health systems to respond after spillover has happened. Investment in containment, preparedness, and response is important and necessary, and also not enough. Spillover prevention is the missing piece that will help us avoid another global pandemic. The main drivers of spillover are tropical forest loss and land use change, wildlife farming, markets and trade, and livestock production in close proximity to wildlife. When humans encroach upon forests, we erase the natural barriers between humans and wildlife. Economic interests are destroying forests at an alarming rate. Over the past 20 years, we have lost over 60 million hectares of primary forest within the great tropical rainforests of the Amazon and Congo basins and Southeast Asia to land use change. Every time humans cut down forests for palm oil, soy or beef, timber or mining, we increase contact between human and wildlife populations and increase our chances of a new virus spilling over. Wildlife trade and markets are another pathway for spillover. Commercial trade in live wild birds and mammals can increase the risk of transmission of the viruses they carry to people. Trade leads to stressed and often injured animals being moved out of the forest and into crowded food and pet markets where they are mixed together. This creates the perfect conditions for the emergence and spillover of novel viruses. In certain contexts, livestock production can be a driver as well. Increasing livestock production near the forest edges puts wildlife in close contact with domestic animals, leading to opportunities for spillover. And the crowded conditions on industrial farms are often similar to those of wildlife markets, with pigs and poultry serving as ideal hosts for viruses, often as an intermediary step as they move from wildlife to people. Reducing spillover will be challenging, but the good news is that government-supported prevention can achieve rapid, large-scale results that reduce pandemic risk. In Indonesia, there has been significant progress in slowing deforestation over the last 4 years due to a government moratorium on forest clearing and strengthened law enforcement. Communities have fought back as well, setting up healthcare clinics and job training programs that have led to a 90% reduction in the number of households relying on logging as a primary income source in those communities. In China, the national government has taken action to close wildlife markets, and provincial leaders have set up compensation schemes in which they help wildlife breeders and traders to stop raising wild animals and to participate in alternative livelihoods like growing tea instead. And in northern Thailand, villagers are able to track instances of unusual disease in livestock and wildlife through a locally built app. This information is shared with government livestock officers who ensure that viruses are identified before they can pass to other animals or humans. These solutions have important secondary benefits. We already know that when we save forests, we are combating climate change, preserving biodiversity, and protecting the original frontline tropical forest defenders, Indigenous peoples and local communities. But now we know that when we fight for the forests and their wild animals, we are also fighting for our own lives. Nature-based solutions to prevent future pandemics are truly a win-win. But these solutions need funding to scale. The global cost of a comprehensive plan to stop future pandemics is estimated to be as little as $20 billion annually, with up to $10 billion needed for spillover prevention. This is a small price to pay compared to the millions of lives and trillions of dollars lost to COVID. The COVID pandemic has taught us that we need a new, expanded approach to global health. We cannot rely solely on a traditional public health response to stop the spread of outbreaks. Pandemic prevention is a global responsibility. No one country can or should bear the cost alone. Now is the time for governments across the globe to address the root causes of why and how new infectious diseases are emerging, and fund the actions we need to prevent pandemics at the source. By doing this, we can stop the next global pandemic before it starts.